Good afternoon, everybody. I'm Byron Day. It is 3 o'clock on this Thursday afternoon. We're awaiting a press conference from Baptist Hospital in Pensacola over what could be a coronavirus case out of Santa Rosa County near Pensacola. And the information we have so far is it is a presumptive coronavirus case because the CDC has not yet to confirm that it is indeed a coronavirus case. But the information we're having that we're sharing with you right now is the affected individual, according to sources there, is an elderly man with severe underlying conditions who had recently traveled internationally. And that's according to the governor of Florida, by the way. Here's what we know. The case is yet to be confirmed by the Centers for Disease Control, but it is assumed that it will be. Again, that's Governor Ron DeSantis talking about that. There are already 8 cases of coronavirus in Florida. So if this is confirmed, this could be the 9th case. And it appears that people are coming into the area now. So hopefully we'll be starting this news conference in just a couple of minutes to get more information about this possible coronavirus case there in Santa Rosa County. Let's go ahead to the newser now.
Well, thanks everybody again for coming this afternoon. We appreciate it. I'm Kathy Bowers. I work here at Baptist Healthcare. We are on a bit of a tight timeline today, so we'll just go ahead and get started. Scott Raines is our Executive Vice President of Baptist Healthcare, and he'll speak, and then they will move the microphones on down the table, and we'll just come down the table.
Thank you, Kathy, and thank all of you for being here today. We've been operating with a heightened awareness for weeks. I can confirm we are treating one patient who is presumed positive for COVID-19. We're very limited on the information we can share for obvious reasons. We've anticipated that we would eventually receive patients with COVID-19. It's not a surprise. We are following all CDC guidelines and monitoring all updates from CDC. We're working closely with our partners in the county and at the state health departments, and we're ready for this. We take care of people. It is precisely what we do. We've been doing it since 1951 when we were formed. We have precautions in place to protect patients, visitors, team members, and others, and we're ready. And that's the message I would like to convey. To that end, I'll turn it over to Dr. Paul Glisson, our Chief Medical Officer.
Good afternoon. I'm Paul Glisson. I'm the Chief Medical Officer for Baptist Healthcare. And I wanted to just go over give you a brief overview of the infectious disease protocols which we follow here at Baptist Healthcare. Certainly, we follow the CMS and CDC guidelines related to optimizing patient placement with the goal of addressing the needs of both the patients as they're individually treated here at Baptist Healthcare, but also other patients in our facilities and our healthcare workers. The CDC issues these guidelines because the prompt detection and immediate triage and isolation of these potentially infectious patients, it's very essential to preventing unnecessary exposures among patients, healthcare providers, and other visitors to our facilities. At Baptist Healthcare specifically, we're doing this by minimizing the chances of exposure in the inpatient and outpatient areas by ensuring rapid triage and isolation, and by also allowing our patients and visitors the equipment required to provide proper respiratory hygiene and cough etiquette. We are adhering to the standard contact and airborne precautions, and that includes the use of eye protection. Known and suspected patients are placed in one of our specially equipped negative pressure rooms. These are designed to isolate the infectious risk from those patients who are treated in our hospital. And then those entering this room are using standard protection, including rigorous hand hygiene, personal protective equipment, which includes gowns, gloves, respiratory protection, and eye protection. And we're also limiting access to these areas to essential personnel. Isolation will continue on a case-by-case basis as we consult with both the CDC and our local health departments. So those don't have an answer as far as how long the isolation will continue. We're also managing our visitor access as needed, and we have more to come on that later. We are monitoring and managing ill and exposed healthcare personnel, and we're certainly doubling down on the training and the education for our own staff. Speaking about our staff, I just want to say that besides the many nurses and other ancillary staff that work here at the facilities with us, there are also very numerous and competent medical staff members, including subspecialties and subspecialists in both infectious disease, pulmonary disease, critical care medicine, and internal medicine who are on the case. And they are agile and acutely aware of the changing situation and ready to respond to our community needs as they arise. With that, I'll turn it over to Dr. Lanza.
Good afternoon. I'm John Lanza. I'm the Director and Health Officer for Florida Department of Health in Escambia County. And this is a community issue, a community health issue. Baptist is a very good partner in the past, present, and I'm sure will be in the future in helping us contain these kind of infectious disease processes, outbreaks. We will be working with them and other members of the community in contact tracing and continuing our disease surveillance, as we do every day in public health. We work with TB outbreaks, we work with hepatitis A outbreak. As you know, that's been going on for about 18 months now. We're still working that. This is something COVID has been known for the past 2 months probably, so this is a new disease of which there is no vaccine and no treatment for currently. Approximately a couple hours ago, I sent out through my PIO an email that sort of described the basic process for when someone thinks they may have been exposed or actually have COVID-19. And this statement has been approved by the health departments in Bay County, Escambia, of course, Franklin, Gulf, Holmes, Jackson, Okaloosa, Santa Rosa, Walton, and Washington counties. So those persons currently at risk for COVID-19, as per the CDC, include 1, someone who has traveled to and from an affected geographic area, including China, South Korea, Japan, all of Italy, and Iran. That more information is available at the CDC website as to which of those countries are currently affected. So those individuals from those areas in which there are widespread community transmission and also have a fever and symptoms of lower respiratory illness, these are the people that we are interested in testing. The second category is someone with close contact with a laboratory confirmed COVID-19 case who is a symptomatic patient and has fever or symptoms of lower respiratory illness such as cough and or shortness of breath. If someone thinks that they have COVID-19, they should call their healthcare provider before going to that person's office so the provider can take precautions to prevent exposing other people in the healthcare practice. A person should review their signs and symptoms and perhaps travel history with their physician. Your physician will evaluate you for other possible respiratory illnesses. Remember, we're in the cold flu season. Flu is still a significant problem. We have RSV, respiratory syncytial virus. We have human metapneumoviruses that are out there that produce essentially the same signs and symptoms as COVID-19. The physician will work with the health department in reporting signs and symptoms to the health department if the physician feels that this could be COVID-19. If the person is without health insurance or a health care provider, please contact the county health department here in Escambia or all those other counties in the Panhandle so that the health department can coordinate your medical evaluation and testing. I'm going to turn it over now to Sandy Park, who's the administrator and health officer in Santa Rosa County.
My voice is a little bit softer, so I'll try to speak up for you. My name is Sandy Park O'Haron. I'm the health officer and the administrator of Santa Rosa County, Florida Department of Health. A reminder for you all that most people that have a confirmed case of COVID-19 have mild to moderate respiratory illness. They can be managed at home safely with coordination between their healthcare provider and the local health departments. Occasionally, and why we're here today, is some people are hospitalized. The main prevention measures that we want to stress today is if you are out, cover your cough or sneeze with the tissue and then discard it, make sure that you wash your hands for at least 20 seconds with soap and water. If you don't have soap and water available, a hand sanitizer at 60% alcohol is your next best thing, but hand washing is always preferred. And also, stay home if you're sick. Consult your medical health care provider and your local health department if you have a concern, but talk to your doctor and avoid sick people if at all possible. The Department of Health works continuously with all our community partners, emergency management, healthcare facilities, EMS, everyone in our community, to ensure that everyone is prepared in the eventuality of infectious disease outbreaks in our county. Additional information can be found at floridahealth.gov and, of course, cdc.gov as well.
Well, that concludes our briefing. It's all the time we've got today. As I mentioned, we're on a very tight timeline right now. So,
Well, no questions? We're not allowing any questions?
we're not open to questions at this time. We will, be constantly updating you all and providing updates to you and other opportunities as well.
There's no
But
further
today
information in the rule about the infected individual, like where he may have traveled or.
Yeah, where's this person traveled? How long has he been treated? What condition is he in currently? All kinds of questions people are gonna ask.
Right, I understand, but we are not able to release any information like that.
And why is that? Why can't you release that? I guess that's the other question.
We have privacy regulations, HIPAA.
As far as where they travel, there's no names, no identity.
What kind of person they are, like their demographic.
I'm sorry, I can't help you today.
Or where they have been, or people they've been in recent contact with.
Okay, you're listening to
Or any
the
idea about where
representative from
they've
Baptist
been, or
Hospital
who they
speaking
may
with
have
some
had
reporters
recent
right now
contact with.
following
I
a
know
news
people are gonna be
conference
wondering,
to talk about the
have I had
possibility of a
contact with the
coronavirus
certain
patient there
Sure,
at
I
Baptist
understand
Hospital
that,
from Santa Rosa
but we are not
County.
able to disclose any of
And
that information today.
The public affairs person that's
Like
speaking
I
right
said, we
now
will continue
is
to update
telling
you as
our
we
House
can.
sheriff, as
We're
well as
just
some other
very,
reporters there,
very
that
limited
they
in
cannot
what
release any other
we are
information
able to,
about the
to
patient
share at this
who
time.
may
And that's
have
y'all's
coronavirus.
decision at Baptist, or is that the county health department's decision not to release any
That,
more
again,
information?
it all
about
ties back
what people can
to
do.
privacy.
About coronavirus, and to talk about there is a possibility that there's a patient with coronavirus and not give any information about the person. I mean, obviously there are HIPAA regulations that you have to follow, but if you're not identifying that person by name, at least we can find out what the governor has already told people, that this person is an older person, 70 years of age, I believe, a male, who traveled internationally and who has presented with what people believe are coronavirus symptoms, fever, respiratory illnesses, or issues rather, and some other things that are going on there. And so the governor has confirmed to the media these things. Obviously, we know that there are 8 cases. Now, the CDC has yet to confirm this case from Santa Rosa County, but this person is elderly with severe underlying conditions and had traveled recently internationally. That's according to Governor DeSantis. And we do know the case is yet to be confirmed by the CDC, but the governor believes it will be possibly as early as this afternoon and maybe tonight. Again, this is, there are so far right now 8 cases of coronavirus there in Florida, and this is the first one that is close to us here in the Fox 10 viewing area. So, but it's a little unusual that they just shut this news conference down as quickly as they did without giving any information about the patient that has already been given by the governor of Florida. So, our House sheriff is there with Fox 10 News, and of course he'll have more information coming up on Fox 10 at 4. Hold on just a second. Let me. Okay, but she's still talking, so let's go back and see what she has to say.
Thank you. Do you think, do you know when we might get another update from you guys?
I don't, but we are we are very committed to sharing what we can when we can. I know it may not, may not seem that way right this instant at this point in time, but we will be doing that. And but I don't know what the timing is on that right now. But I will
So there's
say
no
that.
concern this lack of information will create more fear than it should?
Well, we don't want it to create fear,
Right.
absolutely not. And it's not, it's not a lack of information, it's just that we're just not able to discuss it at length at this time.
Thank you.
Thank you all for coming. Pardon me?
I'm just shooting names.
Oh, I got you.
Okay, that's our House Sheriff, and as you see, the news conference is wrapped up, and we are still awaiting more information about this case. Like I said, the governor has gone on the record as saying, talking about this person, talking about the coronavirus issues that may or may not be present. That is yet to be confirmed by the CDC, but we do know there are 8 confirmed cases of coronavirus in Florida, in the state of Florida. This could be the 9th case, and this one is the first that we know of in the Fox 10 viewing area. But various doctors, hospital administrators, just wrapping up a news conference, just basically saying not a whole lot, to be honest with you, other than the fact that Baptist Hospital is equipped to deal with this type of situation. They've had training for dealing with infectious diseases, and they go over again the Escambia County Health Department person and the representative from the state of Florida Health Department talking about how to prevent coronavirus. And it's a very simple thing. Just, make sure you wash your hands thoroughly for about 20 seconds with hot water and soap. And then if you do sneeze, you do cough, make sure you cough into a tissue or cough into your sleeve. If you do cough into a tissue or sneeze into a tissue, get rid of that thing right away. So, I mean, just some basic information that we're all aware of, but yet we're waiting to get more information about this patient who could possibly have coronavirus. And again, the governor of Florida, Ron DeSantis, has already gone on the record and talked about the fact that this is a presumptive case of coronavirus identified in Santa Rosa County, and that the person affected is elderly with severe underlying conditions and had recently traveled internationally. Now, I'm saying it's a man. We've heard it's a man. It could be a woman. But for right now, they're just identifying the person as an elderly person with severe underlying conditions who has traveled recently internationally. Now, there are several countries that have already been placed on travel restriction, Italy among them. Iran is another one. China obviously is one. So this person has traveled internationally. We just don't know where. But again, this case has not yet been confirmed by the CDC. The state's saying that that could happen sometime this afternoon. But anyway, we do know that there are 8 confirmed cases in the state of Florida, and Governor DeSantis saying that if you look at the data coming out, that the people who are affected are elderly, frail, or have underlying medical conditions. And this is overwhelmingly the group that is most susceptible to coronavirus. Our Hal Sherrick will be with us coming up on Fox 10 News at 4 and 5 with more from this news conference at Baptist Hospital regarding the possibility of a coronavirus case here in the Fox 10 viewing area. I'm Byron Day. We'll see you later.